Symptoms. What are the symptoms of POTS? Now, keep in mind, as I read this list, I got this from, I believe, just the Cleveland Clinic or Mayo or something like that, just a list of symptoms of POTS, just to give you an exhaustive list. Keep in mind, these are very non-specific, meaning that they overlap with pretty much a million different other conditions. And concussion, if you read this list, a lot of these symptoms are going to sound a lot like concussion. So I guarantee that most of you listening that have a concussion right now are going to think, I have this. But you may not. It's still only about 15 to 20% of patients in some of these studies that actually qualify or classify as having POTS that will have symptoms that look like POTS. Okay, so symptoms are high or low blood pressure, high or low heart rate, having a racing heart rate, chest pain, dizziness, or lightheadedness, especially on standing, prolonged standing in one position or long walks, so feeling dizzy as you do that, fainting or near fainting, exhaustion or fatigue, abdominal pain and bloating, nauseousness, temperature deregulation, so either feeling really hot or really cold, nervous, jittery feeling, forgetfulness, trouble focusing, having brain fog, blurred vision, headaches, and body pain or aches, may feel flu-like, neck pain, insomnia and frequent awakenings from sleep, chest pain, racing heart during sleep, excessive sweating, shakiness, tremors, especially with adrenaline surges, discoloration of the hands and feet, exercise intolerance, meaning inability to get your heart rate up or exercise without feeling symptomatic, excessive or lack of sweating, and diarrhea and or constipation. So pretty much anything that you might be feeling could fall into that category, which means that it is very non-specific, meaning that it overlaps with so many conditions that we have a hard time necessarily nailing down the diagnosis of POTS unless there's some other telltale signs that might lead us in that direction.